Sherry, should we give it another minute or go ahead and get started?
Maybe we'll give it one more minute and then we can get started.
Okay. All right, well, it looks like we've got a good group here. We'll go ahead and kick things off. So thank you everyone for joining. I'm sure tonight is going to be both informative and engaging. I just want to remind everyone that as we get going, please feel free to ask any questions. If you put those in the chat box, I've got Sherry and Jackie helping me this evening to monitor the chat box for any questions. We'll make sure to either ask those as we're going. We'll also have some time at the end. So please participate and feel free to ask any questions that you may have as we're going. I'd like to introduce our guest for this evening, Dr. Andrew Greenspan. He is a hematologist and oncologist specializing in cancer treatment for IU Health Central Indiana Cancer Centers. He earned his medical degree from the University of Louisville, returned there for an internship, completed a fellowship at Georgetown University, and he's been named by Indianapolis Monthly as a top oncologist 8 times. Dr. Greenspan and his wife, Ellen, and their children have been members at Beth-El since 2004. Dr. Greenspan, it's my pleasure to welcome you tonight. Thank you for joining us. I'd also like to thank the Beth-El Men's Club for hosting this program. Again, without their support, this would not be possible. So thank you guys. So Dr. Greenspan, to get us started, I wanted to kind of maybe just start with a little bit of current state. What are your thoughts on sort of where we're at with the pandemic right now? Do you feel like Omicron is starting to stabilize? Is another variant around the corner? Maybe just some opening remarks and kind of where we're at.
Sure. I think that we're approaching 20 months into the pandemic. We've seen 4 different mutations of the virus. Fortunately, with the production of billions of doses of vaccine, we've been able to pretty much get it to its current variation, which is a little less virulent, the recent Omicron mutation, and probably less fatal, especially as the population has either been infected and developed some natural immunity, or the number of vaccinated people has increased.
Do you think that trend will continue where we'll start to see the fatality of it continue to go down, but continue maybe to increase the ability to spread and contagiousness?
I mean, that's the hope. The viruses need hosts. So if they're if they're virulent enough to destroy entire populations, such as Ebola could do, then they're not going to have many hosts left. So I think that what we're seeing hopefully with each subsequent mutation, is that they may be very transmissible like the common cold, but they may be less virulent and be less impactful in terms of mortality.
I read an interesting article in the last couple of weeks about corona in the white-tailed deer population. And it was an interesting article. It talked about how, I think it stated like 4,000 deer have recently died from COVID, and that they were tracking across the state of Iowa, all of these different locations. And the fear is that, there's something like, 30 million deer in the US, that it mutates again in this deer population and it comes back to the human side of the equation. Is that something, do you agree with that fear? Do you think that it mutating animals and coming back to us is something that we should be concerned about?
Yeah, I think I think I'd rather it be a population of animals that we don't have a lot of access to than than a domesticated animal. I think that there's probably a greater risk in pockets of the world which are poorly vaccinated at keeping the virus around and mutating, or among those unvaccinated, even here in the United States. But I think it's a bit early to understand the interaction between the animal disease and human risks.
That's a fair point. You know, that comment about it being early to understand, it actually leads nicely into another question. Something that I think seems frustrating at times, right, is how often the CDC keeps changing their mind on, how long you should quarantine, if you don't experience symptoms in 24 hours. And so there, it seems like the guidance almost changes by the day, and you need, a playbook on just how to know what to do. What's your take on why the guidance keeps changing? Are we really learning that much every day, or are they trying to be incredibly conservative? What's your take there?
Yeah, I think there's a little bit of a disconnect between a physician's understanding of a disease process versus what the population and the public desires. I find this in my field quite frequently, in that folks just want to know what's going to happen to them, and want to know where they're going to be at a finite point in the future. So I think with a brand new virus, that none of us have had any experience with, what you do is you evaluate where you've been. You collect as much data as you can and collate it into the present, and with that information try to make recommendations the best you can, hoping that your guidance is somewhat safe for several weeks, if not months, into the future.
That's fair. One of the topics, unfortunately, there's opinions on both sides, if you will, about COVID-19 and the vaccine. And so I want to talk a little bit about the vaccine and just some of those education pieces that you touched on trust. I think one of the questions at the beginning is just, do you feel like people should trust the pharmaceutical companies, knowing obviously they're for profit and kind of some of those different motives? Should we trust the vaccine? Should we trust the pharmaceutical companies and how quickly they've been able to produce these?
Yeah, I think that's a wonderful question, Dan. I think that from a scientific standpoint, all new drugs, vaccines included, need to go through a three-step process. First, they have to be proven that they're safe, and you have to have a dose finding in terms of what dose to move forward with. That's typically phase one. Phase two is the dose you've chosen to be safe. Is it effective against the disease you're treating or aiming for? And then thirdly, once you prove that it's effective, how does it compare to either existing treatments or to placebo, especially with viruses and pandemics versus those who are unvaccinated? And I think that all three pharmaceutical companies went through rigorous testing of their product before the product could ever be fast-tracked by the FDA or eventually approved by the FDA. They have to certify the manufacturing sites, the processes, the distribution, as well as the end users. So From that aspect, I think that, we evaluated probably over 90,000 people in the year 2000, 45,000 of whom received vaccine, the rest placebo, between Johnson & Johnson, Pfizer, and Moderna. And we're able to, with a virus that was hitting 200,000 to 300,000 people a day, we were able to garner statistics and efficacy as well as safety very quickly. And people have often said to me it was too fast. Often drugs take 7 to 10 years to come to FDA approval. Well, but how many diseases have 200,000 cases a day in a given country? That's not to say there weren't, 600,000 to 700,000 a day in the world. So I felt confident with that. I still think that all three companies showed that their vaccines were generally safe and reduced the risk of serious illness or death by, very high confident magnitudes.
Do you feel like now that the vaccines have been out for probably coming up on a year, I'm not sure, do you feel like one is better than the other? Is one ended up being more effective, or do you have an opinion if someone isn't vaccinated and can choose now which one to get, which direction they should go? Does it matter?
Yeah, I think the current thought is that for the mRNA vaccines, Pfizer and Moderna, they were basically what we call 3-shot vaccines to develop maximum protection. Whereas if someone received Johnson & Johnson, they were probably best served by getting one of the other vaccines as a supplement. That's what we consider fully vaccinated now. I can't predict, whether there's going to be an additional requirement moving forward, but that depends on whether this, persists as a pandemic or becomes an endemic virus.
Is there any thought to mixing vaccines as we go to get boosters? Is there benefit to that you're kind of diversifying, or is it better to be specific with a brand and stick with it?
No, it's the data that seems to be intriguing is that those who got Johnson & Johnson, which is still a minority of the world's population. I think that's only about 15% of the vaccinated people. But it seems that if you get either Pfizer or Moderna as a booster to J&J, that the neutralizing antibodies are at a much higher level than if you get a second J&J. So I think most of us are asking to mix that. In terms of Pfizer and Moderna, I've been telling patients that whichever booster is available at the pharmacy that day, I would advise that the only caveat is that the Moderna booster is a half dose of the second shot, and the Pfizer is the same dose as the second, as well as the first shot. So my immune compromised patients or elderly patients, I'm kind of steering toward Pfizer because I think it's a little bit of a bigger dose.
That's good to know. Thank you. Do you anticipate in the future that this is something where every year we go and get a COVID booster, that with new variants coming out, I know it's not the same, but kind of like a flu shot where every season you go and get a COVID booster?
Dan, I think it's a bit premature to say that. I think most virologists and infectious disease experts feel that this is probably going to be a virus that sticks around for a while, especially because so much of the population is either under vaccinated or unexposed or uninfected to date. If that's the case, similar to influenza, I think that it's probably going to be an annual, potentially an annual evaluation.
Do you have any thoughts on our youngest population? So, and this is coming from a concerned parent myself. I have a 2-year-old and a 5-year-old, and my oldest son, 5-year-old, is vaccinated. And so, when that became available, we had a long talk with a pediatrician, decided to get vaccinated, and then now I'm reading that the next kind of age group below that, I think it's like 6 months to maybe 5 years, a vaccine will be available soon. I think maybe end of the month or next month. What are your thoughts on the testing rigor that went into place? Is it safe for children? Is it the same kind of mindset for adults, or is the risk equation different when you think about vaccinating a child?
Yeah, quite frankly, I feel that the more folks we can vaccinate, the more quickly we can, eradicate the virus. I think that they're going before the FDA, at least Pfizer is, on February 15th, with data that they have in the 6-month through 4-year group. It seems to be most effective in the 6-month to 2-year. There's still some questions being raised for reasons I'm not clear on the 2 to 4 in terms of the neutralizing antibodies at the doses that are being used. They're much lower doses even than the 5-year-olds. I think it's 1/10 of the dose of adults. That's the most vulnerable group right now. Those are the people that I'm most concerned about. Many of us have grandchildren, children who are too young to be vaccinated, and it's my hopes that that these studies show that the safety is and the efficacy is much more valuable than the risk of the virus.
Agreed. I think one of the top arguments I hear against not getting vaccinated is that, people say, well, hey, I know a dozen people who have gotten COVID and are fully vaccinated. Clearly it's not working. The government's lying to you. So for those, what would you say? Why is the vaccine not preventing me from getting the virus? Let's say the polio vaccine prevented me from getting polio. What's different about this vaccine? Is it not working as intended, or was this always the intention?
Well, to vaccinate people I'll use influenza as an example. The goal is to prevent serious illness and death. The vaccines have held up in terms of that goal. As you know, with the flu vaccine, which is an annual vaccine, some years it's more effective than others at preventing illness. In the 35 years of my practice, though, with a highly susceptible population, I've never had a influenza death in a vaccinated patient. Now, some of them have gotten sick. Some of them have required even hospitalization, but I've never had a mortality. And I think that's a bigger lesson than, I got the vaccine and still got COVID, because you're much better off than if you didn't get the vaccine and got COVID at about every age range.
So we shouldn't be thinking of the vaccine as a shield that is a protection from COVID, but a minimization of the symptoms, the risks.
Correct.
Okay. What are your thoughts on the at-home tests? I know when they first were developed, it was almost kind of a novelty. Now, and then we had this real demand supply issue. Being able to get your hands on them. It seems like now, at least as I'm looking around, there's all these different brands popping up. Are they all trustworthy? Can we trust the results? Does getting a negative at-home test mean the same as, going into a pharmacy and the PCR? I mean, what are your thoughts on the at-home test today?
Well, the at-home test is a viral antigen test predominantly. and it predicts for infectivity, or the contagious range of the virus. So it's very specific when it's positive that you are infectious and do have the virus. However, when it's negative, there's still probably a 50 to 70% chance that you may still harbor the virus. So the rapid tests are probably best deployed as almost a day-to-day guide. Additionally, with Omicron, it seems that it settles more in the oral pharynx than it may in the nasopharynx. And if so, it may even be deep in the nasopharynx. So these home nasal swabs may not be as sensitive. The PCR test is still the gold standard. The difficulty is it's a slower turnaround time because it's a little bit more cumbersome. But it's almost 100% both specific and sensitive.
Do you think we'll see that PCR test, the speed of turnaround time on the results? Do you think we'll see that start to improve, or is that always be something that just takes a couple days?
Well, with 800,000 people a day being infected with Omicron, and in January, I think that it overwhelmed any of the laboratory capacity that we had. I think that we were talking about 200,000 in the summer of 2020, probably similar numbers, if not that high, in the summer of 21. But 800,000 a day, I don't think any labs were prepared. So I don't know that I'm going to see turnaround time there improve. What I'd like to see improve is the sensitivity of the at-home testing.
Have you heard of any issues with the at-home tests where fraudulent brands are popping up, or they're just selling you ineffective tests? Have you heard any kind of horror stories on that front?
Yes, whenever there's a chance to exploit the population, as in a pandemic, I equate it to looters during a peaceful riot. I mean, it's going to happen. I'm not quite sure how to police that, but I would suggest that you reference the CDC website, and they'll probably talk to you about who the certifiable home test companies are.
Good question in the chat box about the location of the swab. And so, do you think it would make more sense to do the at-home swab in the throat as opposed to the nose?
Well, that recommendation hasn't changed yet. I'm not quite sure why. They're still recommending it in the nasal cavity.
So I want to switch gears a little bit to the topic of masks. I recently read that some states, I think Pennsylvania and maybe New Jersey, are starting to remove the mask requirement for kids at school. I think overall there's sort of this sentiment that it's we're done with masks and it's time to move on. I especially saw that in the summertime. What are your thoughts today on wearing masks? Is it still helpful? Is it still a good protection mechanism? Is it something that we should continue doing and you think we'll be doing for years to come?
Well, I definitely think masks, a good surgical mask, or even an N95, which is a higher quality mask, are effective at preventing virus. In fact, California just did a study, I think that was published within the week, that it provides the N95 is about 83% protective. The good surgical mask that most of us wear is 67% or better. And this is within significant exposure. So I know that masks prevent infection. I think that if worn properly, look, if 80% of the school children, elementary and secondary, were vaccinated, I'd definitely be for such a change in the mandate. But there's still an under-vaccinated population. So I think that, what happens in pandemics is, we either medically get through it by, vaccinating the population, or natural immunity from exposure and infection, or socially, where the society just says, screw it, we're going to live with this, we're going to take our chances. It's unlikely that our children or adolescents will get seriously ill. We feel that it's, better for their psyche and socialization. These are very difficult decisions for public health experts and governors, states. There's just not an easy answer. And I don't truly, know from my personal experience how school children feel. How, parents obviously have a mixed feeling. New Jersey obviously thinks that their infection rate is low enough that it's worth taking that step. You can always, move back if their infection rate begins to climb again. I think that's been one of the problems with our messaging, is that we have to let the public know that this is a dynamic situation where, we have to make decisions according to, what's happening around us. When infection rates are low, we can be a little bit more nonchalant about masks, and vice versa. I think the public's not accepting that so well. And I struggle with that as a healthcare provider.
Do you think we'll ever see the day where you intentionally expose, a child or an adolescent to someone who has COVID so they can get it and build up the antibodies like a chicken pox when I was a kid?
I don't believe so. I think that we, for more reasons than not, I think that if I, as a parent, contracted an illness, I'd do the best I could to prevent my child from getting that exposure. They'll have other opportunities in society to get it at their daycare or their school. I don't think I want to intentionally infect them.
There's plenty to go around. On the topic of masks, you mentioned the surgical quality. You mentioned the N95s. Do you feel like the cloth masks, the kind of ski buffs, are those still effective as well? Or when we talk about masks, we should really be thinking about, the blue, white and blue kind of surgical masks, or the N95s?
I believe so. Cloth masks still give you probably 50% or better protection if they're worn correctly. But, the other masks are, easy enough in supply to get. And they're not, they seem to be more and more comfortable with each generation. And I, as a physician, wear them all day. And that's my feeling about them. N95s, some folks say that there's some very comfortable masks out there. The ones I'm getting provided in the hospital setting tend to be a little bit more confining, as they're supposed to be, at protecting you, but to wear them all day is a little less pleasant.
So another good question in the chat from Allie. Do you think we'll have to continue to wear masks forever as healthcare providers and as patients visiting physicians and practitioners?
I believe so. I think that, you have to learn from all experiences. And I think that any way we can protect one another, especially in an environment where patients are at risk and ill, I think it should be a new paradigm. Now, I think that in society, that's a whole different argument.
Do you think, maybe to expand on that question, do you think there's other places, like, I'm thinking of while traveling on an airplane, or in a movie theater, somewhere where we've got a high density of the population? Do you think that places like that would be mandated to have masks even when this starts to calm down in the future?
Well, I mean, as a physician, it seems to me that it would be a seasonal type thing. Flu season, I think it would be certainly a good plan. I find that in 2020 and 2021, the flu season have been less dominant. Now, whether there's some cross protection of those who are vaccinated against COVID against the flu, I don't know, but there's definitely been far less cases, and I attribute that more to mask wearing and social distancing. So why not, from December through February, in tight places like that, why not at least recommend it? I mean, do we have to sacrifice 25 to 50,000 Americans a year from influenza? I don't believe so.
So to the audience, I have one last question. So I just ask, if you guys have questions at home, please feel free to put them in the chat box as well. I want to make sure you guys are getting a chance to ask your questions. So Dr. Greenspan, my last question here, I appreciate that it's a tough one, but I want you to pull out your crystal ball. What does the next, call it 12 to 18 months, look like? Is there an end in sight for this? Is this just our new norm, and this is everybody just kind of get used to it? What's your prediction for the next, let's just say, year to year and a half?
Well, my hope is that, and again, I make no future predictions. That's just a rule. But my hope is that as we reach herd immunity, as we get more and more of the population appropriately vaccinated in the United States, but even more so in underdeveloped countries, I think that each variation and variant that we see is going to be more like the common cold, less likely to get deep in the lungs and cause congestion of the blood vessels, and be more dangerous. Hoping that hospitalizations will be less, hoping that deaths will be reduced dramatically. I think that's quite possible. It's been that way with other viral models. And my second, because I think that's a more realistic future than completely eradicating this virus, because I don't see that 80% of the world is going to be vaccinated anytime soon.
So something that just becomes more manageable as opposed to completely eradicating it.
Correct.
Okay. Okay, so I see a question in the chat. Can you address the concerns for the elderly population, whether even though fully vaccinated are still at higher risk, and what suggestions might you make as we try to open up our lives to being more normal?
Yeah, I mean, the elderly population who are appropriately vaccinated, the mortality is still quite low. Sadly, about 12 to 14% of the American elderly population, and forgive me for saying that anyone over 65 is considered in that group, but they're only protected if they got the booster as well. So I consider that fully vaccinated. If so, their risks are still quite low. A different population, of course, is those that are heavily immune compromised, organ transplant patients, cancer and leukemia patients, patients with immune deficiencies. I'm not sure they mount a very promising immunity to the vaccines. They're still at high risk.
What other questions from those in the audience? Again, feel free to open up the chat box and put a question in the chat. Oh, so a good question here. So what do we do about being around unvaccinated family or friends? I assume masking, social distancing, are there other considerations we should make when we're going into an environment where we know we're going to be around unvaccinated individuals?
That's very difficult. I think that, and I say we pose a risk to them, perhaps as they, more so than they pose a risk to us. So I think in fairness to the unvaccinated, who are 80 times more likely to die of COVID than a fully vaccinated person, I think that's the argument I would make. Look, I want to be with you. You're a loved one or a close friend, but it's got to be in an environment where we're outdoor, we're appropriately distanced, and again, that's to protect you from something I may harbor.
Some good questions coming in. Thank you guys for sharing. So Dr. Greenspan, what's a good plan to reemerge into regular times, call it kind of pre-COVID times, for someone who's over 65? It's hard to determine what's safe, what's not safe. How do you go about making those decisions and thinking about kind of getting back to quote unquote normal?
Yeah, I think that older populations who are fully vaccinated, who are in social gatherings with other highly vaccinated populations, or outdoor venues where there is appropriate distancing, I think that's safe. I think that if you're going to eat indoors at a facility where it's tight, the ventilation's poor, you're going to be there for several hours. I still feel that I just don't know that I'm ready for that. I think when we get the infectivity rate down to under 10% in the community, which will be soon, then I will feel comfortable in that environment as well.
Are there any other tips or tricks like that where, as the guidance in the beginning was, wash all of your groceries as they came in the door and don't touch any surfaces. And obviously a lot of that guidance has stopped, but in 2022, are you hearing anything on new guidance, new tips and tricks that we can utilize out in the world?
Yeah, I think it's mainly the small particles that tend to be the problem. The larger particles tend to go straight to the ground. I don't believe that the transmissibility from surfaces has ever really panned out, so it certainly doesn't pan out now. Now that we know more about the virus, I don't think we need to be crazy about scrubbing every paper bag down or grocery item.
I'm glad to hear that. That was a real pain. What other questions from the group? And Bob, I just want to acknowledge your comment. I hope that your father-in-law is okay. I'm glad he was fully vaccinated and hopefully got through that okay. What other questions do we have for Dr. Greenspan? Well, there's no other. Oh, wait, hang on. Hal, do we have a question? Sorry. Okay. Why did isolation times change in that guidance?
Yeah, that's I think two main reasons. From a scientific aspect, the in a vaccinated person who is minimally symptomatic, it seems that after 5 days, the infectivity rate drops off dramatically. Now, in an unvaccinated patient, I would hesitate to make the same data statement because it may be 7 to 10 days. I also feel that, there's a huge shortage of both healthcare workers, first responders, essential workers, that keeping them out of the workforce with a minor illness, when they're maybe even asymptomatic, for 10 days was excessive. So I felt comfortable with that recommendation.
Do you think that that number will continue to go down as the boosters become more effective? That 5 days will come down to 3 days to 2 days?
I don't believe so. Well, not with the variant as transmissible as Omicron. I think that, in fact, I believe that Omicron was the most transmissible of all. I think it infected more of the population than either of the other three.
Another good question from Cheryl. What's your opinion on air travel for later this summer? Do you feel to be safe to do so?
Yeah, I must say that at this point in time, I think domestic air travel is fine. I've not flown cross country. I've taken 2 to 3 hour flights and felt quite comfortable because I think people remove their masks less and less on those flights. The airlines claim that their airflow patterns are safe. I honestly believe they're safer at the front of the plane than they are at the back in terms of air circulation. So on a shorter flight, people are masked more percentage of the time. Internationally, I'm a little less concerned because they take such good safety measures. My biggest concern with international travel now is the demands of individual countries about testing. You have to have a negative test to get on a plane to come back to the States. What if you're unfortunate that you contracted the virus on your trip? Then you have to stay back until you're negative. So it creates a little bit of uncertainty. Whether that's going to change in the fall or not is a little bit of a reach. I haven't gotten gutsy enough to make fall international travel plans yet.
Good question, Cheryl. Thank you. What other questions from the group? Looking to see if anyone's got their head down typing here. Okay, so question from Mike. Is it possible that medications like Paxlovid could lose their effectiveness? Paxlovid could lose their effectiveness.
I mean, we could talk about, we haven't talked about therapeutics. There's 3 therapeutics available right now that seem to reduce, severe illness dramatically. Paxlovid being the oral, it's an AstraZeneca I'm not sure who, maybe it's a Novartis product, but and then there's a couple of intravenous monoclonals that are very protective early in the illness. There's also a new monoclonal by AstraZeneca called Evusheld, which is effective for non-infected immune compromised patient populations who may not have generated an immune response. It gives them about a 6-month protection against the virus, which they may not have had. Sadly, all three of the products I mentioned are not in huge supply. The demand well outstrips it. Paxlovid is a nice drug. I'm sorry to say that there's probably about 18 different contraindications that include drug interactions, kidney insufficiency. You almost have to be a perfectly normal human being to be eligible for it, which has been somewhat discouraging. So to know how long it's going to remain effective is a more difficult question for me as to how many people are we going to truly be able to provide it to.
I think a good kind of follow-up question to that. Are you aware of the new Pfizer drug? Do you feel like that'll be a Z-Pack for COVID, if you will?
Yeah, that doesn't seem to have been as effective as Paxlovid in preventing serious illness. But then again, it's going to be probably more widely available, but yet less effective than Paxlovid.
If a person takes an immunosuppressant, such as Humira, is there an increased concern for infection?
Well, the concern is, did you develop, neutralizing antibodies to the vaccine? If there is a test that we can do to see if you actually have antibodies. If you have a qualitatively positive antibody test against the virus, then yes, you'll be protected. If you're on Humira and do not have antibodies, you may be eligible for the drug Evusheld as it becomes more readily available. It's an injection. It's 2 successive injections, like 5 minutes apart, and it's heavily protective.
Good questions, guys. Thank you. Please keep them coming if there's more.
This is a very medically oriented group of questions. I enjoy that.
I've been impressed. Better than my deer question at the beginning.
Well, that's just still a bit an unknown.
I do want to be respectful of Dr. Greenspan's time, so I'll call for any final questions here in the chat. Last call, any questions in the chat? All right. Well, thank you everyone for joining us. Dr. Greenspan, thank you so much. This was insightful, very informative. Thank you for fielding all of these questions ad hoc. And thank you guys again for joining Cocktail Judaism. We hope to see you at our next session. Have a great evening.
Thank you, Dan.
Thank you.
Thanks.